So when you're sitting in front of a fertility expert and they are looking at those numbers in relation to your age, they can let you know where you sit in relation to everybody else.
Let's talk about fertility reviews and how important they are. I've got a number of friends who are interested in doing one, but they've got no idea what happens during one.
During a fertility review, we are looking at a number of different things clinically. So if we start there, you are going to be looking at having, if you are coming for a female fertility review, we're going to be looking at doing an ultrasound scan. It's an internal scan where we're looking at your uterus and ovaries in general. We'll be looking to see if we can see any signs of any kind of gynaecological issues that might be causing you issues in your day-to-day life, or if you're trying to conceive, that might impact your ability to conceive. We're also going to be looking at your ovaries, each in turn, and what we're looking to see in those ovaries are lots of fluid-filled sacs called follicles. We're counting those. Follicles are not eggs. They are what go on to produce and release an egg halfway through your cycle. So in a normal cycle, you are growing those follicles, growing one of those follicles at the expense of all the others, and that's where you would then ovulate from. We'd also be doing an AMH blood test, and that stands for anti-Müllerian hormone. And if we think about those follicles that I just talked about being kind of growing and then ovulating, being like a bubbling pot of water on the stove, your AMH is like the fire below that pot. It's the power that your ovaries have to keep performing that function. I have to admit, I've stolen this anecdote from our nursing director. If you lined 10 women up, all of the same age, they'd all have different follicle numbers, they'd all have different AMH levels, but what we've all got in common is that starts to go down as we get older. So when you're sitting in front of a fertility expert and they are looking at those numbers in relation to your age, they can let you know where you sit in relation to everybody else. For the vast majority of people, their AMH levels and their kind of follicle count will be normal. And if you aren't trying to actively try and conceive at that point and you were just coming in for a check, that might be all that's needed. There's, no need to do anything else. We might suggest that you come back in a year or 2 years and have a look at that again. For people that are looking to try and conceive, or maybe are already at the point where they have been and are looking to proceed with treatment, those clinical indicators can let us know whether we need to kind of move ahead and start to help try and help you have a baby, how quickly we should be doing that. And it also lets us know what doses of medication we should be using and how many rounds of treatment we might need to try and achieve this outcome. So it's a really, really powerful test.